Good afternoon. Welcome to day 325 here at the EMA office and at the new test site at the Clair Fairgrounds. We've been back and forth all day today, but right now I'm here with Chairman Mark Kern and Sam Bierman. Sam, I saw you early this morning, all morning, all afternoon, and now you're here.
Yes.
What a day.
Yes,
Great day.
I'm here for the briefing, and then I will be heading back down to the fairgrounds once we finish up today.
Very good.
It's a great day. We were very excited to start giving the vaccine. As we all know, the National Guard has been there today as well to help us complete this goal. And I have to say that it has been a very inspiring first day. We, of course, have some things that we are going to tweak to make the process even better as we go down the road. But we're very happy with the way things have gone today and are excited to get started.
And we're going to be doing it again tomorrow morning.
We are. We're going to be doing it again for quite a while.
Yes.
But as of today, we have tested 256,268 St. Clair County residents, which is an increase of 1,242 from yesterday. We have 26,161 positive test results, which is an increase of 139 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. Today, our daily county positivity rate is 11.2%. And we are at 230,107 negative test results. Unfortunately, we are announcing 5 additional deaths, which does bring our total for St. Clair County to 415. We had a female in her 50s, a male in his 60s, a female in her 80s, 2 females in their 90s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 24,570. For state totals, 16,100,555 have been tested, with 1,128,613 positive test results, which is an increase of 2,312 from yesterday. And for deaths, the state is reporting 19,259, which is an increase of 16 from yesterday. For St. Clair County hospitalization numbers, currently we have 94 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 151 patients that are admitted due to COVID-related reasons, and 10 of them are on ventilators. For our long-term care facilities that are currently or previously in outbreak status, please remember these numbers are cumulative and we will only announce any facilities that have had changes. Cedar Ridge of Lebanon has 170 cases and 22 deaths, and that is an increase of 1 death for that facility. And Freeburg Care Center has 137 cases and 15 deaths, and that is an increase of 2 deaths for that facility. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. We're excited about the vaccine, but hospitalizations jumped up today. We haven't been this high for about a week, so I think that really speaks to the need that people still need to remember that testing is available.
Yes.
And just remember these masks are important, washing your hands, watching your social distance. Even if you have gotten the vaccine, you still need to continue to do these things just to lower the spread.
Absolutely.
These hospitalization numbers are what's holding us back from reopening to inside
forward.
dining, and so let's just be vigilant on those measures. So we'll look at the zip code report. In 62201, we're up 1 to 547. 62203, up 1 to 572. 62205, up 1 to 599. 62206, up 3 to 1,194. 62207, up 3 to 545. 62208, up 3 to 1,459. 62220, up 7 to 1,841. 62221, up 9 to 2,502. 62223, up 11 to 1,553. 62226, up 17 to 2,877. And 62232, up 4 to 827. 62240 up 1 to 145. 62243 up 2 to 673. 62254 up 2 to 736. 62258 up 4 to 936. 62260 up 4 to 715. 62269 up 16 to 2,951. 62285 up 2 to 504. And 62289 up 1 to 46. 139 new positives today with 1,242 people tested. Brings our county positivity to 11.2%. That's up from 6.6% yesterday, so quite a jump in positivity today. But the rolling average still goes down to 8% today. Regional positivity is also down. We're now at 6.5%. And the rest of the region calls in at Bond County, 1.7%, Clinton County, 4.1%, Madison County, 8%, Monroe County, 16%, Randolph, 2.9%, St. Clair, 3.4%, and Washington County is at 4% today. So Herb, things went very smoothly at the fairgrounds. You know, our compliments go out to you and to Sam and Mila, the whole health department, the National Guard, the hospitals, all the volunteers. It was quite an operation. And every day it's just going to get a little bit better, a little bit smoother, and certainly we'll be bringing bigger numbers through once we get our vaccine lined up and we get a constant supply. That'll make it easier then to do the scheduling.
Well, that's what we want. We want that well-oiled machine. And like I said, we had a good start this morning. Can't say enough about the National Guard. In fact, this coming Wednesday, we're going to have a special guest. I think I gave you the information on that. General Neely will be here, who is in charge of the Air and Army National Guard.
Yes, that should be quite a time to talk to him. He certainly will have a lot of information. And although these are being set up throughout the state, this really, I think, is the largest operation. It's the only indoor-outdoor operation that exists so far, to my knowledge, and it's one where our capacity can really expand.
Well, I think from talking to the Guard people in charge down there today, they're all excited about it. It's a kind of a pilot program, and I think that's why the general's coming in to, they're here in that support role, and that's what they've been doing. Anything we've asked them to do, they've done it leaps and bounds. And I also want to give a shout out to all the local news media. They were there this morning throughout the day getting that word out, because that's what it takes, is to get the word out, letting everybody know. Our sign-up form is still available on the St. Clair County Health Department's site, on the EMA page, on the county website. We're at 59,184 senior citizens that have signed up for that, showing your interest. And Sam, we can't stress enough about they need to get signed up. These are by appointments only, and I think that's what's causing it to be a smooth operation.
And there was a glitch that we need to talk about, or at least a situation when people were signing up. They have to make sure.
Yes. So at the
Explain.
very bottom, when you receive the email that says, please click this link to schedule a date and time for your vaccination, what we ran into a lot today was individuals were picking their date, were picking their time, and filling out all of the information that was requested, but they were missing a very key piece to complete that process, which is at the very bottom. If you are doing it on your phone, it can be quite small. You do need to click the blue submit button. So even though you've picked your day, picked your time, and put in all your information, if you do not click that blue submit button at the bottom, then your registration is not complete. Once you do click that button, you will receive a text message, and in that text message has the information that you will need when you come for your appointment.
Because it will give you a number that you need to have.
Yes, it's what we scan to complete your registration when you get there. If you don't have a cell phone and someone else did it for you, your son or your daughter or family member helped you sign up, as long as someone received that QR code, that solidifies your appointment. We know that it went through. You don't necessarily have to have it when you come. If you can, great, but it's not a must-have.
But a number of people that showed up today just hadn't pushed that submit
Yes.
button. And so then they thought they had appointments. They were notified that they had an appointment. They actually picked a time, they picked a date, but yet because they didn't push the submit button, they weren't on the list.
Correct.
So we helped them. I think everyone got help through that. If you haven't, make sure you call in. We'll get you hooked up and set up. But remember to push that submit button.
One other thing that we would like to remind everyone is that if you receive the email to sign up, please use that sign up for you and yourself alone or whoever it was sent to. Please do not forward it on to family members. As we've said in the past, we are, as the health department, working on that 75 and up age category. So if you do sign up and you do not meet that 75 and up age category or the 1A, which is our medical staff, we will not be fulfilling your appointment, as that's not the groups we're working on. We're finishing 1A and working on that 75 and up age category.
Right.
Great.
The other, we talked to people there today as they was leaving in the waiting areas, and everybody was extremely happy. They were excited to get their shots. I mean, it was, one gentleman told us, said from the time he got on the lot until he was leaving, it was less than 20 minutes, and that was with his a 15-minute wait time, so not bad at all. He was from O'Fallon, a real nice gentleman. Two other relations, brother and sisters, 92 years old, that came and was just excited as could be, and so a lot of happy people.
And that's the kind of service that people deserve, and that's what we're really, that's what we're fighting for, to make sure that people get through there and it's a dignified, easy, nice process to go. As nice as getting a shot can be, that's the way the intent is to get people through. So just remember, be patient. These people are all here and they're trying to serve you, and that's what this is all about. I also want to say that we wouldn't have been able to do this without the state of Illinois, the Illinois Department of Public Health. Our governor, Governor Pritzker, made sure that these personnel are here for us, and when you drive through this facility, you will see a significant presence of people from the Guard, from all walks of life that have been put here because of state reimbursements to create this mass vaccination site in partnership with everybody at this table and Mila and a lot of other people in the community, our hospitals. But we certainly have to give a shout out to our to the elected leadership that brought all this here, and we really appreciate their help. State reps, state senators, everybody, they've all been a part of Team St. Clair, and now the job is, let's get needles in arms.
One group that we can't forget about is our call center. They, of course, when I walked in the door today, they was throwing things at me, but it has been extremely busy, but that's what they're here for. And also the report that they're getting, everybody's been super nice on the phone. They're just looking for answers, and that's what we've started 325 days ago, is being transparent to our citizens of the county, because that's what we all deserve, as the chairman said. And now that light at the end of the tunnel is getting brighter. As I said today numerous times to people I was talking to, we want to get this behind us, but we still need to have patience. So please continue to spread the word, continue to tell your family and friends to sign up on the page showing your interest, because that's where the names are coming from to get that email. Yes, Sam, go
I
ahead.
do have one other thing I would like to remind people, and I may have not been as clear yesterday as I needed to be about this. If you did receive the email link to register for an appointment and you did not get there in time and there were no other dates and times available, please do not be discouraged. You can use that same link to check back daily to see if there are other appointments available. So don't get rid of that email. Keep checking back to see when dates and times are added. So just because you weren't able to get in on that first day, do keep checking back, because we will open and add more days as time goes on.
But that link is just for you.
Correct.
It's not for you
Correct.
to give to other people. That is for you to sign up. It was specifically sent to you because you met the requirements to be in 1B. Giving it to someone who's in 1C or in 2, like I am, it isn't going to help them, because they're not going to meet the requirements to be able to get a shot until their time comes up on the list.
Exactly.
Very good, very informative, and we appreciate the patience that everybody's showing. Team St. Clair, we can't thank you enough. Continue to please spread the word. Tell everybody that that tunnel is getting, the light at that tunnel is getting brighter, and it's because of the patience that you have all showed. So please, we'll see you back here tomorrow for day 326, and we'll have another update on how the mass vaccination site is going. Everybody have a good evening.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.